Welcome to the EMT bag valve mask ventilation of an apneic adult patient skill station. This skill is designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-trauma situation and cervical precautions are not necessary. You are required to demonstrate sequentially all procedures you would perform, from simple maneuvers, suctioning, adjuncts, and ventilation with a BVM. You must actually ventilate the mannequin for at least 1 minute with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout this skill. I will correctly carry out your orders upon your direction. Do you have any questions? At this time, please take 2 minutes to check your equipment and prepare whatever you feel is necessary. Upon your arrival to the scene, you find a patient lying motionless on the floor. Bystanders tell you that the patient suddenly became unresponsive. The scene is safe and no hemorrhage or other immediate problem is found. You have 5 minutes to complete this skill.
I'm checking my bag, making sure I have my supplies. And I do have my supplies. I am ready. BSI, is my scene safe?
Yes.
Hey, are you okay? Are you okay?
The patient is unresponsive.
So I'm going to go ahead and open up the airway, and I'm going to check for pulse, and I'm going to check for breathing, and have somebody call 911.
The patient is apneic and has a weak pulse of 60.
Okay, so he has a pulse. So I'm going to make sure my airway is open, and I am going to look into the mouth.
The mouth is full of secretions and vomitus.
So I'm going to suction the patient's mouth. Oh, of course. And I'm going to measure from the corner of the ear to the mouth and suction only on my way out. No more than 15 seconds.
The mouth and oral pharynx are clear.
Okay. Back in my bag, and I am going to put in an OPA. Measure the same way. Opening the airway.
No gag reflex is present and the patient accepts the airway adjunct.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
Ventilation is being properly performed without difficulty.
So it's attached to oxygen. And it's at 15. Check for a pulse.
How would you know if you're delivering appropriate volumes with each ventilation?
Bilateral chest rise and fall. Do I have a pulse?
Yes, you do.
And I'm doing 1 breath every 5 to 6 seconds, or 10 to 12 in a minute.
That is correct. This ends the BVM ventilation of an apneic adult patient EMT skill station.